As the Delta variant rages and vaccination rates remain low in many parts of the United States, worried parents have one pressing question. How do I send my child back to school safely during the coronavirus surge? Experts weigh in. Coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
This month, school districts throughout the country will begin the 2021 school year. Although most of the conversation in the news has been focused on booster shots and breakthrough infections, parents are frustrated at the lack of advice for families, particularly those with children under 12 years old who are not yet eligible for a COVID vaccine. On social media and at school board meetings, parents say they face an impossible choice: send kids to school and risk a COVID-19 infection, or keep kids at home and deal with the consequences of isolation and distance learning. Public health officials and elected officials, depending on your state, offer conflicting and contradictory information that is putting the health of the nation's children at risk. And to add to this confusion, the head of the nation's leading teachers union has signaled that it may drop its opposition to mandatory vaccinations for teachers. But what do teachers have to say about sending kids back to classrooms, particularly in those states where the Delta variant is surging? And parents, what do they have to say? They're super anxious and uncertain about what the future holds for the 2021 school year. My first guest is Angela Skillings. She is a second grade teacher at Leonore Hamley School in a small town in Arizona. Last year, she and two of her co-workers, contracted COVID-19 while teaching virtual summer school together in the same classroom. She was on the show last year shortly after contracting COVID and unfortunately having one of her colleagues pass away from the virus. Good morning and welcome back to the show, Angela.
Good morning.
Wow, I'm still reminded of your good friend, teacher Kimberly Chavez Lopez Bird, who passed away from COVID. She was one of the three teachers in that classroom with you last summer. You all were teaching virtually, but you were in the classroom together. I just want to ask you, how are you doing? It's almost maybe over a year later since that happened.
It's been a little over a year, and it's kind of difficult still to be in the classroom. We did summer school all summer long with students in the classroom. So having them back in was a little bit frightening at first, but I think I'm kind of getting used to, how to keep them separated and getting them to stay healthy themselves.
And what are you hearing from your parents? The headlines are parents are confused, they're anxious, they're worried that, they don't know what advice to follow. What are you hearing from parents?
A lot of my parents are concerned of what I can do to keep their children safe while they're in the classroom. A lot of them are worried that their children will get sick, and then what are we going to do once that happens? How are we going to support the child and the family? A lot of my parents are excited their kids are back in the classroom. Today's our first day, so they're sitting in there with their friends that they haven't seen in a year and a half. And they're excited, but we're nervous. So made sure we have our masks where it's not required, but recommended. And then we have our partitions around each desk. And so just doing what we can to keep them safe.
So I know that you're in Arizona, and Arizona, like most of the country, is seeing a surge in the Delta variant. 2,000 additional cases have been added over the last 5 days in your state, and under half of the residents in the state of Arizona have been vaccinated. Does that worry you at all as a teacher going into a school building knowing that half of the state has not been vaccinated? So that means kids are coming into contact with their parents, many of whom have not been vaccinated, their grandparents. You may actually be in a building with other, staff members who are not vaccinated.
Yes, it is very worrisome. I have 7 and 8-year-olds, so we know they're not vaccinated. And I don't know what they're bringing in from home, who they've been in contact with. So it's just a play it by ear and try it, pray for the best every day. As for staff, our staff is all pretty much vaccinated and we rely on one another. We're very honest and it's like our own little family here. But even going school clothes shopping for my own children was really hard to do because I didn't want to be around so many people.
Yeah, no, you, first of all, I'm glad to hear that about your school and how you have this family and this community and you all are speaking openly because we know that vaccines have become as polarizing of a topic as masks. And in your state,
Yes.
Governor Ducey, governor of Arizona, has really doubled down and he said no mask mandates. And he said he will not be listening to what he called the lockdown lobby. So I know, it's like, okay.
Yes.
Colorful language from Governor Ducey. But you are wearing a mask, but obviously there's no mask mandate in the state of Arizona. Has your community, the staff in your school, decided to wear one voluntarily, even though it's not mandated?
Yes, we decided we were going to wear them voluntarily. And then we asked our parents, we recommended to our parents that their children still wear masks, especially in our bigger classrooms. I have 27 students. So we recommend that they wear masks. I had 2 that came in today and said, I don't have a mask. And I'm like, here you go. And they're like, thank you. And so I can tell you they're all in there with their masks on. In the community itself, people are still walking around with masks, still trying to stay safe. We've already lost people. We don't need to lose anymore.
No, it's such a great point. What are you hearing from parents about the mask wearing, particularly because you deal with these young kids? You have 6 and 7-year-olds, you said, in your classroom. And I was talking to a parent a couple of weeks ago. She has school-age kids, like second grade, like you teach. And she said she wasn't sending her kids back to school this year because she lives in a state where there is a mandatory mask wearing for kids in school. And she's worried that she says she thinks wearing a mask is harmful for kids all day. Are you hearing any concerns like that? Parents who are saying, I don't want my 7-year-old in a mask all day.
I've heard a few parents concerned about that. And it's very few, maybe 3% of my classroom. And I just tell them, we recommend that they wear them. If they're not going to wear them, that's fine, but they will be sitting behind a shield. And I also do let them know that every hour we go outside, take the masks off, separate from one another, take our masks off and get some fresh air. So it's not that they're wearing them all day, all the time. I'm going to make sure that they have time. But as I said, our district just recommends, since we can't mandate that the mask be worn, we just recommend that they're there. And the parents of the ones that had concern, their kids came with masks today. So they really thought about it.
Wow, I'm glad to hear that so many parents did send their kids to school with a mask. Like I said, you teach kids who are under 12 years old, so they're not even eligible for vaccinations at this point. So I don't know if you saw the news, Angela, but the head of one of the largest teachers union came out and said that she believes the union will not oppose, mandates for teachers. She says that 90% of all teachers across the country have already been vaccinated, but we've seen top experts call for vaccine mandates for teachers. What do you think about that? Do you think teachers should be required to get vaccinated in order to go back into a classroom?
That's a hard one. I really think that it's got to be the teacher's choice. I understand wanting them to be vaccinated, and I understand the concern, but I think we have to leave it up to the personal influence of each person, because we can't make it political. We need to make this humanitarian. And as long as we keep pushing people to do something that they don't want to, I don't think it's fair to society itself.
But Andrew, how do you square that against, and I assume in the state of Arizona, for kids to even start public school, don't they have to be vaccinated with for measles and mumps, chicken pox, and those other routine vaccines that kids get? Is that required in Arizona?
It is required, but there is also a waiver that parents can fill out with the school. So again, I come back to it's got to be a parent's choice. I even left it up to my own 13-year-old if she wanted to get vaccinated or not. I didn't force it upon her. Of course, she chose it after seeing how sick I got, but To me, I have to leave it at parents' choice.
Mhm. I want to bring into the conversation Shanta Driver. She's the National Director of United for Equality and Affirmative Action. She's a civil rights attorney who's been fighting on behalf of families and students, primarily in the Michigan area. Welcome back to the show, Shanta. Good to see you.
Thank you. Good to be here.
So, Shanta, I know last year you led an intervention to prevent buses from actually driving school kids to school in Detroit out of fear that the classrooms in Detroit weren't safe at that time. How are you feeling now about, schools reopening August? Most schools around the country are going to be going back for the 2021-22 school year. Are you feeling like the schools in the state of Michigan are safe now?
I do not feel that. I think it's completely reckless and wrong to be reopening schools at this point. We've been through this, Areva. We went through it last year. We heard last year, August, September, October, it's okay. By November, schools had to shut down. They had to shut down because reopening the schools caused community spread of the virus. It started really spiking then. And right now, we also know that there's so many new variants of the virus, and it's going to keep mutating. And if students are in school, that virus is going to adapt to make sure that it can enter little bodies and do what it does to adults, which is kill people or leave them disabled. I think all schools that are opening have to mandate vaccination for all students and for all teachers, for all staff, and there have to be mask mandates. I don't know how you can safely send your child to school who is 11 or 10 or 8, who, when there isn't even a vaccine available for those young people, they have nothing to protect themselves but hope and prayer. And science has shown already that that is not enough. We really need to reconsider this issue, and where schools are reopening, they need to demand mandatory vaccines and masks, and they need to continue to offer virtual education for those young people and their families who do not feel that it's safe for them to return to the classroom.
Yeah, and I want to bring into the conversation Dr. Jeffrey Klausner. He's a professor at USC Keck Medical School and an infectious disease expert who has advised the FDA, the World Health Organization, and the National Institute of Health. He joins us again this morning. Good morning, Dr. Klausner. I wanted to bring you into the conversation because Angela is a teacher, second grade teacher in Arizona. She is a COVID survivor. She was in a classroom with a co-teacher who actually died from COVID. She now says she's back in that classroom with 7 and 8-year-olds. She is wearing a mask. Most of the kids are. She doesn't believe that there should be mandates. Shanta's a civil rights attorney, advocate in Michigan, who says she thinks that there should be mandatory vaccines for teachers and students before they return to the classroom. Help us understand here, what's the safest way to get kids back to school? And are these mandates, as Shanta suggested, for teachers and students required in order for kids to be safe and for staff like Angela to be safe in the classroom?
All right. Well, thank you for having me on again. And it's wonderful to be here. And it's really important to hear, different voices and, people's perceptions. And that helps us really, as we make recommendations in public health to understand, what are the concerns at the community level. But, as an epidemiologist and an advisor, I always go back to, what the statistics are. So I just want to start this off, this conversation with just kind of what's happening on the ground. So in California, up till now, so over the past 18 months in California, there are about 420,000 cases in 5 to 17-year-olds. And in the same time, there are about 404,000 cases in those who are over 65. So, large numbers of cases in California. California is one of the largest states. 1 out of 8 Americans live in California. Among those 400,000 cases among children, 5 to 17-year-olds, there were 23 deaths. Similarly, in the 400,000 plus 65, there were 46,000 deaths. So over 2,000 times the number of deaths. The risk of death in a child, and I agree, every death in a child, devastating. I've had, friends lose children. I've had taken care of children over my career as an infectious disease specialist. It's awful. But from a public health perspective, we have to think, what is the real risk of the population? So for a child to die in California was 1 out of 18,000. For an adult 65 plus, it was 1 out of 9. So those are huge differences in what the risks are. And then before I got on with you all, I looked at the statistics in Florida, very similar. The age, breakdown is a little bit different. So in Florida, among 5 to 14-year-olds, 1 out of 30,000 deaths, 1 out of 30,000 deaths in 5 to 14-year-olds. And in 65, about 1 out of 10. So again, similar big differences in risk. So I think when we think about that, we have to think, okay, well, what's practical and what can we do? So we know that vaccinations are very safe, very effective for, preventing hospitalization and death, approved for 12 years of age and older. From a public health perspective, it makes a lot of sense to make those required for everyone 12 and up. With exemptions, right? If you're, have a severe allergy, some other medical contraindication, then it's not safe for you to get vaccinated. There's people who won't respond to vaccine because of their immune system, but the idea is to get as many people vaccinated as possible. So from my perspective, that's what we need to double down on. The masks, can be helpful, certainly in indoor, crowded settings with poor ventilation. I think if, masks are what's required to get kids back in school, we need to mask. So right now, the best we can do is get all 12 and age plus vaccinated, but with a focus on the adults, with the teachers, the staff, the people in school settings. In California, as you heard, all healthcare employees in the state must be vaccinated. Large cities, San Francisco, Los Angeles, are mandating all municipal employees, which are fire, police, environmental, sanitation, must be vaccinated. And that's really, what we need to do to get ourselves out of this epidemic, is get as many as we can vaccinated as possible. Ideally, if everything, what was less serious, we could leave it up to, individual, choice and education and persuasion. But also part of the reality is that we have very low levels of education in some communities. And, those low levels of education, serve as, fertile ground for a lot of conspiracy theories, a lot of, fake news, and a lot of false information that, can't necessarily blame people for, accepting that misinformation, but they do. So from a public health perspective, often we have to be paternalistic and do the best we can for the most amount of people, which is to require vaccination.
Dr. Klausner, we heard Angela say that her kids are not in mask all day, that she gives them breaks, they get to take them off and on. But we hear a lot of anti-maskers for kids talk about, the kids not getting enough oxygen. We hear people saying that the kids can't see the faces of their friends, and that makes the kids unhappy. It makes them sad. They can't meet new people. But address that oxygen point. Is there any, validity to that?
Yeah, there really is no validity to the idea that, masks prevent oxygen, right? I mean, there's plenty of people who wear masks, professionally because, they're painters, they're working with, chemicals, they're surgeons in the operating room, they're, professional skiers. There's lots of different people who wear masks for hours, and it's safe and does not affect the oxygen. And I love the idea of, having breaks when you're outdoor play. So, there was a lot of misinformation and misemphasis about, how scary playgrounds were and outdoors, but actually outdoors is very safe and playgrounds are very safe. So, let the kids play outside in recess, without masks for that period. And when they're back inside a crowded classroom with poor ventilation, but we need to do more, to ventilate classrooms, keep doors open, keep windows open as best we can.
Andrew, I'll ask you, early on, there was a lot of talk about just what Dr. Klausner said, the schools, doing ventilation changes, changing their filtration systems, socially distancing, doing contact tracing. Is your school doing any of that today? Seems like all of those kind of measures fell by the wayside.
Oh no, our school changed the filtration system. We still do temperature checks as students are coming on campus. We still have social distancing when possible. Kind of a little hard with our larger numbers this year. Still, like I said, the masks recommended. They are constantly in contact with the health department. Last year, when we were told by Governor Ducey that all students had to be coming back into class in March, we had 85% of our students and not one case the rest of the school year. So a lot of what we do really has helped. Every classroom has a sanitizing station. You know, we have hot water. They made sure everything was ready so that the students could be safe.
So Shanta, listening to what Dr. Klausner said about, the low rates of death vis-a-vis young kids versus people over 65, and clearly what he said about schools being safe to return, particularly if you're encouraging or mandating vaccines, does that give you any comfort that going back to school at this point is safer perhaps than what some of the headlines out there suggest?
No, it does not. And for one reason, I think we don't know about Delta yet. We're just learning that this is a much stronger variant of COVID, that it can infect and place in hospitals. We know now in places where there have been spikes that it's 20 to 40-year-olds that are ending up in ICUs. So we know that this particular strain of COVID is successfully attacking and debilitating and in some cases killing people that in the last wave of COVID did not seem susceptible to it. So I just feel like it's just not good enough odds for me. If I had a child and someone said, well, it's 18,000 to 1 that, your child won't die. No, I'm sorry. My child could not be in school, not if they can continue, especially if they can continue to learn virtually at home. I tell every parent I know, don't send your kid back. You just can't do it. It's just not safe. We'll know as of Thanksgiving whose predictions are right. And I have to say, I believe that my predictions will be proven to be right. And I'm hoping that I'm wrong. There are a lot of times you want to be right, but in this case, I would sure like to be wrong, but I don't think that will happen. I had been saying that after July the 4th, we need to give things 2 or 3 weeks because that's when all of the demasking was being, advertised and people were being told, oh, you can burn your mask, throw it away. Okay, 3 weeks later, which is, a couple of weeks ago, we started seeing spikes. And it was clear that, no, it was not right to throw away your mask, that those gatherings of people were not safe. And they're starting to be canceled again. Big concerts are being canceled, even outdoor concerts. And Wall Street, the Journal today said that many, many businesses that thought that they would reopen in the fall have decided to continue to work virtually from home. Yeah. So I feel like the evidence is out there that it is not safe. And I definitely agree with the doctor. And I was so glad that he raised the mandatory vaccination because that is one thing I very much agree with.
Well, let me ask you this, Dr. Klausner. Address Shanta's point. She says the 18,000 to 1 odds are still too risky for her. There must be other situations where we are facing risk in terms of activities that we engage in that suggest that these aren't really bad odds at all. Can you help us understand that?
Right. So I think that's a good point is that, a lot of people, forget about, everyday risks like going swimming, right? And how many, swim related deaths there are in pools and in, at the beaches every year among children, or how many, permanent injuries there are among, motor vehicle accidents, or how many, other kind of, traumas there are from, pedestrians. And, these things are risks that we accept. And, part of the challenge has been that the media, has been laser focused on COVID, right? Because, scaring people about COVID, sells news. and are doing not a great job of putting, the risk into context of what we do with our everyday life. So, experts have said if we get down to, fewer than 100 total deaths a day. I mean, right now our death rate is definitely too high. So I certainly, agree with that. We're at about 500 deaths a day. But if we get down to 100 or fewer, COVID deaths a day, that puts us in a similar space where we are with influenza. So, every year influenza kills some children, unfortunately. I've taken care of those children. It kills, young adults, older adults. And, we find it somewhat acceptable to, have a society that's open, that's economically vibrant, that's supporting, education in school-based settings. And I think we'll get there. It's just going to, take some time. I also looked up today, so August 9th, what is the hospital census in the United States? So right now there's 60,000 people in the hospital in the United States due to COVID. 1,000 are pediatric cases. So, everyone thinks, oh, well, it's children are in the hospital. Yeah, there are some children in the hospital, but, still the overwhelming majority are, older adults. And right now, those older adults, are non-immune. So they even haven't been vaccinated or they haven't had prior infection. So the current epidemic is definitely an epidemic of those who are non-immune, either due to lack of prior infection or lack of vaccination. But I agree, Areva, putting risk into context into our daily lives, recognizing, people do sports, people go swimming, people, travel in cars and buses, and these are, normal things we do every day and accept some level of risk.
Angela, do you have any questions for the doctor? One thing that concerns me, I know you're not in favor of mandatory vaccinations, but I do worry about this under 12 population that can't get vaccinated, who are going to be around teachers, many of whom may have pre-existing conditions, may have weakened immune systems. They're going to be going home. We know in Black and Brown communities, there may be intergenerational living situations. So they may be going home to, families that have elderly people who are sick. Do you have any concerns about that? And any question you want to ask the doctor about safety in that regard?
Many of our kids go home to multi-generational families or babysitted, they have babysitters that are elderly. So my main concern, I don't know if I have a question, but is what I'm doing good enough? Before they get on the bus, I have them wash up their arms. Some parents have me spray them with Lysol on their backpacks so that their backpacks are clean too, because they've been in the classroom. And I'm like, okay, whatever the parent wants, I'll do it for them. But is what I'm doing enough? These kids can't get vaccinated. So is there washing their hands every, half an hour to 45 minutes after touching things okay? I know we do community pencils. They use their pencil. It goes into a bucket. We sanitize it at the end of the day. Crayons, markers, all of that stuff. But is what I'm doing enough is my main concern.
That's a great question. I got a little nervous when you said spray the kids with Lysol. I'm glad you corrected that. You said spray the backpacks with Lysol.
Right.
But great question, Dr. Klausner. Here's Angela, really concerned, passionate, dedicated teacher. Is she doing enough for these 6 and 7-year-old unvaccinated little people?
Well, I mean, the best thing you can do right now is to keep, the ventilation going and keep, kids outdoors and keep the windows open. On the buses, make sure the windows are open and there's good ventilation there. I mean, we have not actually seen a lot of evidence that there's, spread by, packages or backpacks or pencils or pens, and even the temperature screening. I mean, the CDC does not do temperature screening of its own employees anymore. They don't do the symptom checks that I at my university are still subjected to on a daily basis. So they found that those are not particularly useful, and people tend to, not be completely honest on those symptom checks if they want to work or have to work. So I think, the best thing, one can do is make sure that, parents are educated and the parents are aware of the benefits of the vaccine. So if I were concerned about protecting the parents of the children and the multi-generation households of the children in my school, I would have more sessions with those families about the benefits of, vaccine. And every day I have, like, from 4 to 5 p.m., I have these 4 15-minute sessions with people who want to learn more about vaccine. And people, have some just very simple questions they don't understand about the mRNA. Is that going to stay in their body forever? They've heard about, the vaccine can cause infertility, and these things are fake news, but, people want to hear it from an expert and, want to hear, well, why have they heard that? So just continued education for families about the benefits of the vaccine. As I mentioned, 65 plus, about, depending where, 1 out of 10 may die. So there's still plenty of 65 plus who would benefit from vaccine. And many of that generation have seen the benefits of the vaccine for, elimination of polio, elimination of measles, and these were childhood diseases that they grew up with that are no longer around. So they know about the benefits of vaccines. They're concerned about safety. So continued education, I think, is the best thing we can do.
And Shanta, before I let you go and let the doctor go, do you have any burning question for him? I know you're not convinced that these schools are safe. I guess for you, you'd want to see all teachers and all kids vaccinated. We know we won't get there in anytime soon with those under 12-year-old kids because those vaccines haven't been approved yet. But is there anything you'd want to ask the doctor that might help you feel, a little bit more at ease that this process of kids returning to school in your state in Michigan is perhaps a little safer than you believe?
Well, I just find what he says really contradictory. So I guess I'd like to hear him address this issue, which is, on the one hand, he's saying, educate people, make sure everyone who can get vaccinated gets vaccinated, because that's what makes us safe. And we know there's no vaccination for children under 12 years old. And I don't understand why we are projecting now that it's going to be safe for those young people to be in school knowing they haven't been vaccinated. And so I would really just like to hear from the doctor how he reconciles those contradictions.
Right. So I think, we've learned that the risk of infection is different than the risk of disease or hospitalization, right? So children can get infected, and that's definitely true. But the likelihood they're going to get sick, hospitalized, and die from that infection is very, very low. So I mentioned in Florida, between 5 to 14-year-olds, over 150,000 kids infected, but only 5 deaths. 1 out of 30,000, in 18 months. So that's 5 deaths in school-aged children over 18 months. So that's very, very low. Obviously, but before they died, there was a bunch that were hospitalized, but generally the rates of hospitalization are also very, very low. So 672 kids hospitalized in Florida through the end of June. So now I agree with Delta. It's more spread easily. So we should see, some increase in the number of infections that will result in a small increase in the number of hospitalizations. But kids, just for whatever reason, they don't have the same receptors on their cells. They don't have the same immune response. They don't suffer the same severity of lung disease and pneumonia. Just very, very less likely to get sick. And I know that's kind of hard for people to wrap their heads around, as children look very vulnerable, right? They're smaller, they're younger, they look weaker in some way. But, for some infections, this is common that children are much, much likely to get sick. So chickenpox, for example, if a 30-year-old gets chickenpox, 1 out of 5 will end up in the hospital, and many adults with chickenpox will die from chickenpox pneumonia. Children get chickenpox, before the vaccine, and it is very, very rare that they went to the hospital or died.
Yeah. Well, we've got to leave it there. Thank you so much, Angela, for everything you're doing, just being such an advocate, having survived COVID yourself. Trying to keep those young people as safe as possible. Make sure you don't get the Lysol on their little legs and hands as you're spraying their backpacks.
Right.
Oh, and thanks, Shanta. Always good to hear from you. And Dr. Klausner, always a pleasure. Thank you for helping us understand what's happening with kids and getting back to school. Really an important issue. Thanks.
All right, take care. Bye-bye.
Thank you.
Take care.
Thank you.
All right, coming up next, we've been talking a lot about Florida because Florida has been in the news lately. So my next guest, he's in Florida. His name is Andrew Spar. He's been on the show multiple times. He's the president of the Florida Education Association, one of Florida's largest association of professional employees. Good morning and welcome back, Andrew.
Hey, thanks for having me. It's great to be here once again.
Yeah, you can't have a conversation, Andrew, about COVID and kids without talking about Florida. In the news
Yes.
so much lately, your governor DeSantis sparring with President Biden. You know, he's got this viral video where he's, challenging Biden. They're going back and forth. Some of it's, I guess, tongue in cheek, but we're really talking about serious issues here because Florida is the epicenter of COVID right now. It's not New York, it's not California. 23,000 cases in a single day last week. The third straight day with 20,000 or more cases in a day. What do you make of what's happening in your state?
Well, I think if you look at this map on the screen right now, it clearly shows we have massive COVID spread in the state of Florida throughout the entire state. And that's what's been concerning. We have a governor who's decided politics is more important than actually making sure we are taking care of the safety and well-being of our students and everyone in our community. You heard the doctor talking about COVID cases in kids in Florida. And what we're actually seeing now, actually, the Miami Herald is reporting that the steepest increase in COVID cases is actually in children under the age of 12, while the smallest increase in COVID cases is in senior citizens age 65 or older in Florida currently, largely because the senior citizens over 65 are vaccinated at well over 85% at this point. And so I think that's driving it for sure. And we are quite concerned. School starts in Florida tomorrow in most of the state. And as these kids are coming back, we're concerned about some outbreaks we may see all over the state.
And so, headlines about your hospitals are back to, capacity. Doctors are angry. They're angry at the governor. They're angry about, this surge. They're angry about being in the position now that they were in, last year, and in some ways even worse. So I live in California. Our Californian governor, Gavin Newsom, made some missteps with COVID last year. And some folks got together and did a petition, and now there's a recall election for the governor of the state of California happening very shortly in September. Does Florida have a recall law similar to California?
No, Florida does not. So the only way a change in governor could be made here in Florida is at the ballot box in a normal election cycle, which will be in a little over a year. But here's the bottom line. I mean, realistically, this is a governor who has said only public schools cannot do everything needed to keep kids safe. I want to be clear on that, right? Like, he didn't say private schools or charter schools couldn't do this. He didn't say businesses couldn't do it. He said public schools may not in any way put procedures in place that may keep kids safe. And why is this important? Because in public schools, we have locally elected school board members. We have school boards who are constitutional officers who are given authority under the Constitution to ensure the welfare, well-being, and education of every child that attends our public schools. And public schools are, in fact, the best place for kids to learn. 90% of Florida's children come through Florida's public schools. We take every child. We don't turn any children away. And we want to make sure that every child, regardless of race, background, or zip code, is getting the education they deserve. And the governor, quite honestly, right now, is a roadblock for that happening.
But help us understand. So you said the governor has honed in on these public schools to the exclusion of private schools and other entities. Are you suggesting that it's because these local school boards are run by Democrats, and this is a Republican versus Democrat fight? I mean, why hone in on public schools if 90% of the kids in Florida go through public schools?
Well, first of all, I think we should realize that this whole response to COVID should be a bipartisan issue, right? And so what happens in school boards, there are Democrats and Republicans on school boards, but because they're closest to the people, they're really the closest elected officials, they interact with parents on a daily basis. They have kids often in the public school system. And so therefore they have that drive, that need to make sure they're working together. And so school boards do. And then when school boards are listening to the medical professionals, which we should do, right? When they're listening and looking at the numbers in their communities, they're listening to parents who are saying, hey, keep my kids safe. That's what I'm telling them. As my daughter, my youngest, is about to go back to middle school, I want to make sure that she is safe. That's what every parent wants. And so they're hearing that and they're saying, you know what, they're going to mandate masks. And so what the governor decided was, hey, there's a political opportunity here. And he's doing the politics of division to create division among the electorate so he can get reelected. That's not what we should be doing. We should be putting children first everywhere. And a public health emergency is a bipartisan issue. Like, this should not be this, unfortunately, from former President Trump to now Governor DeSantis. They see this as a wedge issue for political purposes. A health emergency, a public health emergency, should not be a political issue.
But to be clear, Andrew, the mask mandate or the lack of a mask mandate, or the ban on any mask mandate, I guess is the best way to put it, applies across the state, right? So it's not just schools can't enact mask wearing as a mandate, but a private business can't require you either to come in, to gain interest into their business. You can't, require someone to wear a mask in the state of Florida, can you?
Actually, they can't. Disney World has required masks at Disney World in Orlando, Florida, and a lot of other businesses have required masks now for people to come into their establishment. The mask ban only applies to public schools, nobody else, not private schools, not charter schools, not any private business. And not
private business. So if you're private business, you can require in your restaurant, in your bar, in your office building, you can require a mask. So they
could. Now, I will say a lot aren't, but they could. What they can't do is require vaccination. And that's where the nuance is in that, right? You were talking earlier that Randy Weingarten, the president of the American Federation of Teachers, has come out saying we should work with school districts that want to do mandated vaccines for their employees so that everyone is getting vaccinated. Nationally, about 90% of union members in the education arena are vaccinated. And in Florida, about 82% of our members are vaccinated based on a survey we did of our members. But even we should be encouraging.
If that teachers union comes out, which they have now, in support of vaccination mandatory for teachers in a state like Florida, that wouldn't carry any weight, right? You can't at the local level or even at the school district level mandate vaccines for your staff. Wouldn't that run smack dead into the ban that the governor has implemented, his executive order?
It's not 100% clear because the governor keeps playing games with it, and so it looks like what the governor has said is businesses can't require vaccinations, but it appears that employers might be able to. So Disney World, for example, is another one that's looking at requiring vaccines for all of their employees. We've heard of other big businesses in Florida doing the same, where they're looking now at mandating vaccines for their employers. They just can't check they can't check any customers that might be coming in to see if they're vaccinated as well. And actually, the governor just lost a lawsuit or a temporary setback, I guess you can say, in the cruise industry because he wasn't even allowing cruise ships to require vaccination. And one of the cruise lines, Norwegian, actually just got a judgment from a judge, a temporary injunction, so that they can require everyone to be vaccinated who enters their cruise ships.
But I want to make sure I understand you. You're saying that it's not clear to you that an employer, i.e. a school district, that they may still have the power to mandate vaccines for their staff, despite this ban on vaccines otherwise implemented by the governor.
Correct.
Wow. Okay. So have any school districts taken that up? Have they, stepped out there boldly and said mandatory vaccines for all of our teaching staff, all of our school employees?
No, what we've seen so far in Florida is we've seen where some districts are saying that if an employee is vaccinated, they may get one district, for example, is giving them a stipend if they get vaccinated, an incentive to get vaccinated and show that they're vaccinated. And that's a financial payment, and others are giving what they call COVID leave. So if a teacher is exposed to COVID, gets COVID, or has to quarantine, they would continue to pay that teacher without them having to use their own personal leave. So there's a lot of incentives going on that are encouraging people to get vaccinated. And again, a lot of local unions are working with them.
So they're not doing mandates, but they're trying to incentivize people to voluntarily get the vaccine.
Correct. No mandates yet.
What about this law now, or this extension of you guys already have this kind of, bullying law that allows for a kid, if they've been bullied, to get a voucher so they can move from a public school to a private school. And now apparently the legislature has expanded that law to do, to include something called, I don't know, COVID harassment, mask harassment. But, a kid that's at school, I guess, and is asked to wear a mask and they feel like they've been, singled out or bullied by a teacher can go home, tell mom or dad, and mom and dad can now apply for a voucher and leave the public school and go to the private school. Is that how that works? Did I get that right?
Yeah, you did. And it's even crazier than that, to be honest with you. The Department of Health in Florida has set the standards for when kids have to be quarantined or isolated if they are exposed or get COVID, right? So that's being set by the Department of Health. But then the Department of Education is saying that if you quarantine or isolate students, that could be considered bullying, and therefore a parent could then ask for a voucher to go to a voucher school. And mind you, that many of these private schools that accept vouchers are requiring masks and actually have stricter standards than the public schools are being allowed to have. So it really is crazy. I was
trying to wrap my brain around that, thinking, okay, now I move from public school A to private school B. What's going on at private school B? Are the private schools somehow not requiring masks and are not, quote unquote, bullying kids about masks and quarantines and all the other precautions that the CDC is recommending? Are the private schools that different?
Yeah, listen, I'll tell you, the Archdiocese of Miami, for example, which runs all the Catholic schools in Miami, they actually have a mask mandate in place unless you're vaccinated, for example. So they're doing both, encouraging vaccines and having a mask mandate. Some other well-off private schools, either in Tallahassee or in Orlando, they have actually require mask mandates or requiring strict isolation and strict isolation and quarantining rules if someone is exposed to COVID, much more than school districts are even allowed. So the reality of it is, at the end of the day, we know the best place for kids to be to learn is in the school, and in the public school for that matter. And what we want to make sure is that kids are allowed to do that safely. And again, this whole thing with bullying and stuff like that, this is a public health emergency. Enforcing rules to keep everyone safe is not bullying.
I don't want to be cynical about this, but who is this helping? Is this like giving, white kids in public schools a way to go on the public's dime to private schools? I mean, like who's being helped here? I can't imagine this poor black or brown kids are somehow being helped by this. So who's being helped?
Yeah, I do think it's geared towards getting more kids who are more affluent into the private school and get them the assistance and to go to private school that they may not even need, mind you, right? These could be wealthier individuals who have the means to send their kids to private schools, and they could be using this as a way to get assistance in doing that. But let me also point this out, right? They've been trying in Florida for years to amp up the private school voucher program and charter schools. 90% of kids still go to public schools in Florida. They haven't been successful. So this is yet another attempt to undermine public schools and the work that our public schools are doing and kind of abandon them and try to force parents and kids to these private schools using these vouchers. That's what this is.
Does Florida have a vaccine mandate, like when you enter kindergarten? Like you have to show proof of vaccination for mumps and measles and chickenpox. Do you have those kind of standard, vaccines?
Yep, we do. All kids who enter our school system must have certain vaccinations. And then my daughter, who's going into 7th grade, that's when they have to do a lot of the boosters again. And so we had to show this year for her to be re-enrolled back into 7th grade. We had to show all those vaccinations had been done and up to date.
So help us understand why this vaccine then is being treated so differently. We've heard the arguments about it having a temporary authorization, not permanent authorization from the FDA. That's one of the excuses that comes up frequently. But what is the logic behind we can mandate a vaccine for kids for mumps, measles, chickenpox, get a booster in the 7th grade, but this vaccine, for kids who are 12 and over, if the vaccine is available, the mandates don't apply?
Yeah, other than politics, I'm not sure what the difference would be, right? Because as I pointed out earlier, senior citizens in Florida have the highest rate of vaccination, and they have the lowest amount of community spread right now. And then the kids who cannot get vaccinated right now have the highest amount of COVID spread. And even people in their 30s and 40s and 50s in Florida have very low vaccination rates and very high COVID spread right now. So there's clearly an impact that could be dealt with. If people had gotten vaccinated in Florida, if our governor had been encouraging vaccination in Florida throughout the entire pandemic, I don't think Florida would be in the position it's in right now.
So where do you go? School's starting. You said tomorrow, right?
Yeah, most of the state tomorrow. Yeah.
School start tomorrow, Tuesday, August 10th. No mask wearing, no vaccine. And the vaccine also, so obviously the teachers can't be required, although you said 83 or so percent of teachers in Florida are already vaccinated. But that means 17% are not. So you've got some percentage of unvaccinated staff members in schools. You've got 12 and under kids who definitely aren't going to be vaccinated because it's not even available to them. Maybe some older kids, parents have chosen to get them vaccinated, but you just got this hodgepodge of people coming together, all who are potentially, dangerous to each other. What's going to happen in these schools?
Yeah, that's the biggest question and biggest concern right now. I will tell you, a few things. One, some school districts are bucking the governor and they are requiring masks. Alachua County, which is Gainesville, Florida, Leon County just announced this morning, which is Tallahassee, that they're going to have masks with no opt-out provision unless there's a doctor's order otherwise, right? And then a lot of other counties are bigger counties. Broward County is going to be discussing it tomorrow, which is Fort Lauderdale. But Palm Beach County, Orange County, Hillsborough, which is Tampa, and then even Duval County, which is Jacksonville, they all have mask mandates with an opt-out provision, with the assumption that most parents aren't going to opt out, which I think is probably true. There are some districts here really trying to figure out a way to keep kids safe as much as possible. The other thing I'll tell you is I know of 3 lawsuits so far that have been filed by parents in federal and state courts saying that the governor's ban is actually illegal. The parents challenging it in the federal court are parents of students with disabilities who may have increased health risks. And by the governor saying that this is a free state and we're not going to force people to wear masks, they're saying, what about my rights and the rights of my child to be healthy and safe at school, which is required under the Constitution here in Florida.
Yeah, I'm so glad you bring that point up because, these my personal right, my personal health arguments, I think are overshadowing the broader issue about the health of the majority of Americans. So yes, you may have some personal liberties, but your personal liberties can infringe on my personal liberties. And when you refuse to wear a mask or you refuse to get vaccinated, then you are putting me at risk. And we saw this with smoking in this country. We've done such a good job. Took a long time, too long. But we finally got there with the notion that you're smoking, maybe your personal liberty. But when it starts to, create health issues for me, i.e. secondhand smoke, then that's where we have to draw the line. And I just it's so regretful that we're not able to see this health crisis, this public health crisis in the same way we saw the smoking public health crisis, that, these individual liberties can't impose. And I'm a mother of a special needs child, and I know how difficult and challenging it is. And I've had so many kids in our organization, Special Needs Network, nonverbal kids who've ended up in the hospital because of COVID. So can you imagine your kid goes to school, limited verbal, nonverbal, gets COVID from a perfectly verbal kid, and now you have your nonverbal kid in a hospital, can't communicate, separated from their families. So some of these parents, they're not thinking about their choices and how they impact others who are so much more vulnerable.
So I want to say a couple of things on that, right? One is it's not a lot of parents who are speaking out against this. What we're finding is that there are people who do not have kids in the schools at all, and they are the ones saying schools should not be demanding masks. So it's a political thing, and there's a political operation behind it, where people are literally being bussed into some school board meetings just to say, don't do this. And they don't have kids in the school system. So that's an issue. 2, we actually have had 3 children, 16 or younger, pass away in Florida from COVID in the last week alone, which is obviously quite concerning. One of them was known not to have any underlying medical conditions. The other 2 did, but still very concerning. And then the other part I think is important here in all of this is, some people are saying they're holding out that they're Christian people or they're very religious in their beliefs. And yet, whether it's the Torah or the Bible or the Quran, everything I've ever looked at, even spiritual literature talks to the fact that we should take care of others. Like we should be concerned about others, take care of thy neighbor, thy family, and so on. And so it doesn't make sense that we would say, I'm not going to do something because I don't want to, even though I know it's going to keep others safe. That makes no sense, because you can't hold yourself up as a truly person grounded in faith and spiritual aspects of life and not be concerned or care about others. That's just not what any teaching shows us, right?
Yeah, I think you're right, Andrew. We've got to leave it there. Yeah, this argument, this public health crisis has become, as you said, a political, pawn in the hands of elected officials. It's so disheartening to me. I asked you about that recall law in the state of Florida because I can't imagine that if you had one, that there wouldn't be enough people to sign a petition to do a recall on DeSantis. The choices that he's making for that state, all to posture and position himself to, maybe run for president, as a Republican in the next, presidential election or whatever his aspirations or goals are. And you just look at, like I said, 16-year-old kids dying of COVID, hospitals, filled to the brim, and parents rightfully so worried about what's going to happen to their kids, all because one man has decided that he will not follow science and he will implement his own rules. And, people be damned. It's basically, just people be damned, whatever happens to you. And I worry about underserved populations in Florida, who don't have a voice, who are in those intergenerational households, who are with 65-year-old people and older. And, my heart just breaks for them. So your beautiful state, all of that, the beaches and Disney World and all that Florida is known for, is now a COVID epicenter. So,
yep.
Yeah,
absolutely.
We'll keep
Thanks
our
for
eye
having
on
me.
the
I really
story. Just one last question I want to ask you. Any, thoughts that this experiment is going to, fail, and that you're going to be back in a situation where kids are going to have to go back to distance learning? I mean, as much as these politicians are just forging ahead saying, go, 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 there is still that possibility that some schools will have to close. What do you think will happen in Florida?
Yeah, I think there's going to be outbreaks. I think those outbreaks are going to drive the at least temporary closure of classrooms or schools in order to make sure that people are safe. We actually already have a school before the school year even started. They have like 10 or 12 faculty members all with COVID, and it was spreading throughout the school. They shut the school down. They're trying to get things ready for the start of school tomorrow, but they're not even sure they'll have the staff there to be able to actually open tomorrow. I have not gotten an update on that, but those are the kinds of things that I think we will see happen. And it's unfortunate because, quite honestly, none of this needed to happen. If we had a real vaccination process and we're promoting vaccines here in Florida, if we took other precautions to make sure that everyone was safe and healthy, I don't think people understand. And there's a frustration, right? Because a month ago, we were all thinking things are going to be pretty good this year. And then, wow, just this massive spike in a very short time. And what we've learned with this Delta variant is not only can people who have been vaccinated get the Delta variant, it spreads really fast. And that's the part I think that's very concerning to me as a parent, and to me as someone who cares about our public schools and our fellow man, that we need to really do what we can to keep everyone safe. It takes an entire community. And as you said, this is a public health emergency. It requires an entire unified response, not a politics of division response like we're seeing from our governor.
Yeah, just quickly, are you on board with this mandatory vaccines for teachers? You think that's the right way to go?
I think what we're talking about, and this is what Brandy Weingarten has said at AFT, I think we do need to support and work with school districts who want to implement mandatory vaccinations to make sure that can happen.
That's the ones that want to, but what do you think across the board, want it or not?
I think we will eventually have to get Personally, I think we'll eventually have to get to a place where we're doing mandatory vaccines, because it doesn't look like, even at this, and you again listen to the medical professionals, and they're telling us that we're going to be dealing with this for a while. So we've got to do everything we can to make sure we get in front of it. That's how we essentially eradicated chickenpox. That's how we eradicated, for all intents and purposes, smallpox and polio and all those other things, is there was a mandatory vaccination. And, we should not become a climate and a culture in which we ignore experts. Like, I believe in trusting experts. I wish they would do that more in schools. Trust the teachers and the administrators and the people who work in our public schools as public education experts. And let's trust the doctors and the nurses out there and all of the medical specialists who are giving us guidance on the research they have. Yes, research is always changing, so the guidance may change over time to adapt to what's happening, but we should listen to them as experts, because they know what we can do to keep ourselves and our community safe.
Great point. And we will end on that, Andrew. Always good to see you. Good luck with your daughter on her way to Howard University. That's amazing.
Yes. We're very excited.
Mandatory vaccines for her. So
yes,
she
does it, and they did have to at Howard. Yes, they did.
Most private and public universities. I'm glad to hear my daughters are headed to Columbia, and they've got to get shots too. So shots in arms matter. Again, thanks so much for joining me, Andrew. Always good to see you. And we're going to keep our eye on Florida. My goodness. I don't know. That Miami trip I had in mind might be canceled, but continue to do the great work that you're doing, and hope to see you again soon, my friend.
Thank you.
Thanks to all of my guests, and thanks to all of you for joining me. I just want to make one thing really clear. We've tried with these vaccines. They've tried to have $1 million lotteries. They've tried to give people sporting tickets to sporting events and free college tuition. And that was moving the needle a little bit. But what we've seen move the needle the most in terms of those people that have been hesitant or stubborn about vaccines are these mandates. Some cities, some states are showing huge upticks in the number of people getting vaccinated when they are told that in order to come back to your job, in order to continue in your career, in order, to gain access to a Broadway play or a restaurant, you've got to be vaccinated. And so Americans, I'm really over this, our personal liberties. At some point, you got to check your privilege, because that's what it is. Check your privilege. There are people dying of COVID. There are kids who are dying, people who have long haul COVID. And a lot of it is because of irresponsible conduct on the part of Americans. And there are so many ways that this government infringes on our personal liberties. And that's what you have to do to have a civilized society where you can have people coexisting, living together in something called a civilized society, like seatbelts, like smoking bans. There's so many examples that I could rattle off where the government is telling you what to do. So get over this point that somehow vaccines are different. It's really no different. This is a public health crisis. It's a public health emergency. It's killing people. It's killing disproportionately Black and brown people. It's getting people critically ill. And we're not going to get out of this until everybody in this country is vaccinated. And that if that requires the government telling you to get vaccinated, I hope the government has the courage and the guts to step up and do that. If that requires your public employer or your private employer doing the same, I hope that they do so too. And we're seeing more and more folks from Walmart to Disney to Amazon just announced 900,000 employees that work at Amazon to ship you all these packages have to be vaccinated. You know why that's a good thing? Because we know that plants have been the biggest spread throughout this virus. So all those people stuffed in that Amazon plant, getting you your box, now they have to be vaccinated and keep themselves safe and then keep their families safe. So I won't go on because I get really irritated with these selfish arguments that people make about why they won't get vaccinated. And yes, I know there are historical reasons for Black folks. I understand that. I've had a gazillion shows. We've talked about it. We've tried to address those issues. So I'm not dismissive of that. I know those health disparity issues are real. But even so, what I also know is real is that Black people and brown people die disproportionately from COVID. So we've got to figure out a way to get past our past and move into our future in a healthy way. All right, some words to live by before I get out. Facts matter and science matters. You heard Andrew say that. You heard the doctor say that. Yes, it's true. I know this news can seem confusing and sometimes contradictory, but even in the midst of what may seem like chaos, facts and science still matter. Parents must resist the urge to follow whack websites on the internet and dubious experts peddling junk science. Yes, that's what it is, junk science. The nation's leading scientists and experts don't always agree on everything, but they have been consistent about the fact that there are two things that work to combat this virus. Those two things are vaccines and masks. So get yours today. I'm out, y'all. Be safe out there. Don't forget to wear your mask, and don't forget we're all in this together.